studio. This morning we are honored to have as our guest Victoria Raymond. Victoria has woken up very early to be with us. She's out in California, so we've got her here on video feed. And she is vice president for the Guardant Health company, who makes a test called Shield. And if you remember an episode or so ago, we talked about colon cancer and we talked about alternatives to colonoscopy. And there are times where you need an alternative to a colonoscopy. She offers one of those tests, and it's a blood test that detects DNA in colon cancer. And she's going to educate us this morning on that product. So, good morning.
Good morning.
And let's start with the basics. The Shield test. Tell us what Shield is and how does it differ from traditional colorectal cancer screening methods?
Yeah. So Shield is a blood-based colorectal cancer screening test, which is very exciting. The traditional colorectal cancer screening tests, as you mentioned, have been colonoscopy and stool-based testing. And those tests work great for detecting colorectal cancer and detecting those precancerous lesions. But unfortunately, too many people are not getting screened with those methods. And so the Shield test provides a new way to get screened for colorectal cancer through a simple blood test, and it's FDA-approved for that indication.
Now, the test is drawn in the office. How long does it take for the results to come back?
Yeah, so it's a simple blood draw. It can be drawn in the office. It can be drawn alongside any of your other standard of care bloods that are being drawn. And the results are actually returned back to the provider and the patient within 2 weeks of receipt at our lab.
Awesome. Can you walk us through the science behind Shield? So how does a blood-based test detect for colorectal cancer?
Yeah, it's pretty exciting. So the test itself, what we're looking for is actually in the blood. As cells grow and divide, they actually release some of their DNA into the bloodstream. And so when we draw a blood sample, what the Shield technology looks for is it looks for patterns within that DNA that can raise the concern that this is someone who may have colorectal cancer. Now, it's important to remember that Shield is a screening test. So if that Shield test does come back positive, that does not mean that this person has colon cancer. It's an opportunity to say, hey, let's take a second look. This is somebody who actually we need to do a follow-up colonoscopy for to determine if there's something going on in their colon. So it's looking for those signs that can raise the suspicion that there's something going on, but it's not a diagnosis of colon cancer.
You know, the trick is always do tests like this have a good sensitivity and a good specificity. So when we talk to our audience, our patients and our viewers, they want to know what sensitivity and specificity is. And basically sensitivity is just how good is the test at picking up the disease. Specificity is how specific is it? Are there any false positives? And what are the percentage of false positives? So can you speak a little bit on the sensitivity and specificity of Shield?
Absolutely. So the sensitivity and specificity of Shield, when we developed this test, we wanted to make sure that it was performing in terms of sensitivity and specificity in about the same way that you see from the stool-based testing. And it is. When in a very large clinical study, the study that we used to take this test to the FDA of over 7,500 people, the sensitivity or the ability of the Shield test to correctly identify colon cancer was about 83%. And that's about the same range that we see for stool-based testing. The specificity, or as you mentioned, our ability to correctly identify those people that do not have any signs or symptoms of colon cancer was about 90%. And the flip of that means it's about a 10% false positive rate, as you mentioned. And again, that's about the same as you see from stool-based testing. So what we have is a test that has performance metrics that are aligned with stool-based testing, but in a different and something easier way to complete with a simple blood draw.
So how do patients typically respond to this blood test screening? Are you finding that there's higher screening rates in the underscreened population? What kind of data do you have on that?
It has been so exciting to hear from patients when they learn there's a blood-based testing option. You know, most people know that they need to get screened for colon cancer. They know about how to stay proactive in their health, but it really is just challenging to make it a priority. With stool-based testing, unfortunately, there's an unpleasant factor to dealing with your stool and collecting your stool at home. For colonoscopy, we know that requires time off work and time to do the prep, and sometimes that's very challenging to do. And so a blood-based test, something that can be completed right there in your provider's office, is something that's very, very, very exciting for patients that want to be proactive but have had barriers to doing that to date. And we've been doing a lot of work trying to understand, can a blood-based test get to that unscreened group, that group of people who unfortunately just has not been able to complete colorectal cancer screening. And we actually just published a study out of 2 clinics in the Appalachian region, which is a region that is severely underscreened for colorectal cancer. And we found that when we integrated Shield into an option for them alongside stool-based testing, the rate of colorectal cancer screening completion went from 45% completion rate to 90% completion rate. And interestingly, about 69% of the people that got screened when we introduced Shield as an option were a group of individuals who had never been screened. 69% of people. So we know it's a test that people are going to complete, and we know it's a test that can actually help us chip away at that group of individuals that hasn't been screened yet.
So this seems like a major step in what I'm going to call precision oncology. So how do you see this technology, and how does your company see this technology evolving over the next decade?
Yeah, it is an exciting step. I am so excited about it, and I'm glad you are too. So as we think about it, we have now shown with Shield that we can use this technology to detect cancer in the blood. We have shown that now that this test is available, that people will do it, and we can actually get more people up to date with screening. So as we think about kind of our next steps in this screening world, we actually are just wrapping up clinical studies in lung cancer screening. So for those individuals that have a smoking history, lung cancer screening is recommended, and actually only about 14% of people that are eligible for lung cancer screening do that screening. And so we are hoping that a blood-based test alternative will actually help improve that screening. And then after that, we think about those cancers that people get concerned about, but unfortunately there is no average risk screening that's recommended. Cancers like ovarian cancer and pancreas cancer, cancers that unfortunately are often diagnosed too late. Can we use this technology to detect those other cancers as well? So it's an exciting space now that we've shown we can do it. Now we just have to continue generating data to look at, can we do it in other cancer types as well?
I think a question that we get a lot in the office from patients is, when will Shield be covered by commercial insurance? Currently, Shield is for 65 to 85 years old. Is that correct, with Medicare coverage?
So the FDA approval for Shield is for those individuals aged 45 to 84. And then you are correct. Right now, the insurance coverage that we have is for those individuals who have Medicare. And so Medicare coverage for those individuals, and Medicare also actually covers the follow-on diagnostic colonoscopy for those people who have a positive Shield. So that's really important as well, as we've talked about. And then, you know, it's been less than a year since we've gotten FDA approval, so we have some work to do with expanding that coverage. We did recently get coverage for those individuals who received care through the Veterans Affairs Community Care Network. So that was one of our recent coverages, and we will continue chipping away, trying to get expanded coverage for those patients with this new technologies.
If a non-Medicare or younger person wanted to pay for Shield and it wasn't covered under commercial insurance, what could they expect to pay?
Yeah, so the list price for the Shield test is $1,495. For those individuals who would like to proceed through that route, then they can talk with their provider about ordering a test. For those individuals who have other insurances beyond Medicare or the VA Community Care Network, if their provider thinks Shield is the best screening option for them, then we actually can work with their insurance company to determine what that coverage is, and then let them know what that out-of-pocket cost might be.
All right. So looking ahead, are there other cancers or conditions that you believe could benefit from a similar blood test that you had mentioned about lung cancer screening and ovarian, pancreatic cancer? Is there any other screenings that you think would benefit from this test?
Yes. So we actually are just getting ready to present some data at an upcoming cancer conference, the American Association of Cancer Research, where we're actually talking about a version of the Shield test that is actually multi-cancer and looks for 10 other cancers. So colorectal cancer plus 9 other cancers, esophageal, gastric, bladder, ovarian, pancreas. Typically cancers that don't have average risk screening guidelines, and trying to understand if that test can bring some value to patients and providers to be screened. So exciting to continue expanding that technology.
So Leah and I are very proud to be able to offer this test to our patients. Our patients have embraced it. They've asked for it by name, and we wanted to bring it to our viewers to make it more aware to everyone that we do offer cutting edge oncologic cancer type testing in our office. We want to thank you, Victoria Raymond, for joining us this morning. And I know it's early for you, so it was very nice of you to get up at the bust of dawn to join us, so to speak. Have a great weekend, and thank you for joining us on Preserve Health Talks.
Thank you very much. I appreciate the opportunity to meet both of you and to chat with your audience. Enjoy the rest of your day. Thank you.
Bye now.
Thank you.